Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA certified organic hemp and CBD brands, and all of its hemp is grown from the perfect topography and climate found in Colorado. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Hey everybody, John Malanka here with the United Patients Group. This upcoming podcast, I think you're really going to enjoy. It's with an old friend, Dr. Paul Bregman, MD, out of Colorado. And he gets candid. He opens up, talks a lot about personal stuff that he's gone through when it comes to mental health and bipolar. So he's experienced depression, bipolar disease is the way he mentions it, how it's affected his life, not only as a father and a husband, but also his identity, being a doctor. So he's lost his job because of being bipolar. And he goes through of what he's done to bring it back to where he is today. So I think you're going to enjoy this. So we'll see you on there. Bye-bye. Welcome back, everybody. This is John Malanka with United Patients Group. Be informed and be well. Today, I have a special guest. This is a friend that Corinne and I met early on in this industry. I think around 2011, 2012, at a conference, and have stayed in touch over the years as well. Paul Bregman, MD, Dr. Bregman. How are you doing, Paul?
It's good to see you. I'm here in Denver, Colorado.
Really good to see you as well. And so I appreciate you reaching out. You know, we've kept in contact over the years. I remember we met when Corinne and I had a home office, so that was a long time ago, and then kept in contact ever since. And then you reached out again recently, just checking in with me, and I was checking in with you, and paid your condolences with Corinne. And I know, like everybody in this industry, love Corinne, and so thanks for being who you are. You have a great story, and the reason I have Paul on, because Paul's seen both sides of this industry, one as a doctor, a medical doctor, but also as a patient. And I think his story will be very touching to many of you that may be going through the same. And so, Paul, have at it. Please introduce yourself. I know you're a cannabis doctor, you're an MD, and a patient. So can you share a little bit of background and then where we are here today?
Sure, it's a pleasure to see you. It's a pleasure to be here. Thank you very much. My story is interesting because I'm a board certified cannabis expert, and before that, a trained radiologist that I practiced for about 10 years. But I also suffer with a chronic mental illness, bipolar type 2, and which is different than bipolar type 1. And so I'm speaking to you from the perspective of both being a doctor, but also trying to manage his bipolar 2, which has been a difficult time. I was diagnosed, I'm 70 now, I was diagnosed at age 41, felt the effects starting at age 29, and ultimately had to retire disabled because of the bipolar type 2 and depression in 1995. So now it's 2020. So I come at this from the point of view of my bipolar was, medical school was fine, and I became a doctor and I went into residency, and that's where my mood started to shift, but I really didn't know about it. So I went through my 30s and finally got diagnosed with a mood disorder, the bipolar type 2, in 1991 when I was 41 years old. And so with that, I was diagnosed with a psychiatrist, and I was practicing radiology at a big city and county hospital, being successful in radiology and breast imaging. And then I spoke to him, and that began a saga in the world of mental illness and trying to be treated, and then worked and subsequently married and divorced, etc. Cannabis has played an interesting and life-saving role for me, in combination with expertise from the Western world and psychiatrists, combined with expertise in the cannabis world, because I was a latecomer to cannabis as treatment. I should go back and say that my father also suffered with bipolar type 2, more depression and irritability. He was more irritability. There's bipolar type 1, which is more mania, manic depression is the old term, mania and depression. Bipolar 2 is mostly irritability as well as depression with some hypomania, which is to a lesser degree. For me, the depression is the worst, and what caused me to go and finally resign my work and go inactive and be disabled. And then that was at age 45. And it also turned out to be that it was treatment resistant. In fact, that I tried all of these different cocktails of medicines, antipsychotics, antidepressants, all of them, maybe a 15, 20 different cocktails. And they really didn't work for me. So ultimately, I wound up going to electroshock therapy between 1994 and 2002 every winter because of seasonal affective disorder. And the electroshock therapy worked, but there were a couple of traumatic experiences that happened 1 in a million times. And I didn't go back because I was too afraid. That was in 2002. So between that time, it's been a very suffering depression. I had to leave work in 1995. I ultimately got married in 1997 to a woman, and we had 2 children. I was age 51 when I had my first child, and 54. So I have a 16-year-old and a 19-year-old child now. And my ex-wife is 17 years younger. But the key thing for me was the fact of realizing that I had this illness, and it was very difficult because it's taken me a very long time to come to grips with the fact of having a chronic mental illness. And when medicines didn't work and the doctors, and I was faced with electroshock therapy every year, and I got afraid of that for some incidents, I found cannabis in 2005. And with that, I just read an article. I went out to the garage. I took a couple puffs of cannabis flower. I wasn't a big user before then. It lifted my mood within a minute. I came back to the house. I had like a 2-year-old and a 5-year-old, and it changed my personality for the first time like no other medicines, in the fact where I felt like a normal person, and I could be laughable, I could be friendly, I could be embracing, I could be all of the things that I would imagine a young father to be to their children. I wasn't necessarily high. My mood had been lifted up. And that's the way it's been for me since 2005 or 1995, where I've used cannabis in addition to some Western medicines, Depakote and temazepam for sleep, and some Valium at times. But in combination, if I don't have the THC that lifts my mood and it makes me be productive for at least 2 to 3 hours, and I can't use edibles because of a defect in the metabolism of my liver, but so I inhale just a little bit, and it lifts my mood, makes me productive, and makes me a happier and easier person, less irritable, and certainly lifts my depression.
Well, thank you for that. You and I have had many phone calls over the years, which have been some tough phone calls of just sadness and depression, saying, where do I go? And so, you're not alone. And then to a lot of our listeners, I know this is gonna resonate to a lot of our listeners, because a lot of people feel alone going through this. When I had Beth Dost on talking about her fibromyalgia, she was kind of hesitant at first to say, I have fibromyalgia for the past 20 something years. And we had so many people that wrote back to us and said, that's what I'm going through. I thought I was alone. Let me go back to you mentioned Kim earlier at the very beginning. Was that your ex-wife?
Christy.
Christy. But who was Kim?
Kim, I don't know.
Okay. I don't know her either. I mean, it's you. Well, you did give me hope because I'm 53 and I don't have kids, and people are saying, "When do you have kids?" I'm like, "I'm too old." So you had your first at 51. So I'm
Right,
right there
but
with
my
you.
whole life has been really predicated on
Yeah.
the fact of this mental illness.
Yeah.
My marriage, my
Yeah.
having children, my everything has been predicated on the fact of a matter of survival and
Mhm.
trying to make it work. It's a very topsy-turvy life.
Yeah.
And this is the reason why people with chronic mental illness over a period of time, on top of what I had with the depression, there's some depressions that don't have this, and some depressions have suicidal ideation. So I've gone through at least 3/4 of my life thinking about suicide, but never trying to commit suicide, but just being scared of it, as
Yeah.
well as having the kids and things like that. So it's a really a tough, and so it's affected everything in my life.
Yeah. And I know that. Uh, Before I went to Kim, I was going to go back to your father. Um, was he clinically diagnosed? Because we really didn't hear about bipolar until last 15, 20 years. At least.
No, he was not clinically. He
Yeah.
came back from the war. He
Oh.
got married to my mother. He had 2 children, just fell into that whole thing.
Yeah.
I was born in 1950.
Yeah.
He got married, I think, whenever, soon before that. And they had 2 children. And so he never thought about going to a psychiatrist.
Yeah. Probably not, huh? And then with your other sibling, how are they doing?
My sister does not have the illness.
Uh-huh.
She, she doesn't have it. But
Yeah.
she's very successful and her mood is on an even keel,
So
which is the way it can go.
yeah. Yeah. Um, with cannabis, cannabis wasn't your lifestyle, like many of the doctors and nurses and experts that we speak to,
No, not at
and,
all.
and
Not
patients.
at, not at all. I
Yeah.
used it minimally. I used some other drugs along the way,
Yeah.
a little cocaine here and there when I was in my 30s and things like that, Quaaludes and things like that. But I never did LSD. I never smoked a lot of weed. No, this was not part of my MO. Drugs, no. Alcohol, no.
Not at all. Not at all. So with you trying that, have you always been in Colorado?
No, I was born in New York City, raised in New Jersey, college in New Orleans,
Uh-huh.
and then my first job was in Portland, Oregon, and then I've been here for 30 plus years.
Gotcha. But you were the first time you used cannabis when you were 41, or I say the first time you used it.
Oh no, the first time that I used it was when I was in medical school a few times, and that type of deal.
Yeah. But
College,
when you,
I didn't use it in college.
yeah. No, but when you
Six,
went snuck out to the garage, were you living in Colorado at that time?
yes, I moved here in '87, and at
Yeah.
that time that was 1995. I was in Colorado.
If the reason I say where I'm going with this, if you did not live in Colorado at that time, do you think you would have tried cannabis?
Yeah, because at that time I still had to get the cannabis illegally. So wherever I was, and I read that article,
Oh, so
I would.
you knew about cannabis and bipolar.
No, I just read about cannabis and mood
Oh,
and
okay.
lifting my mood. So
Yeah,
wherever I was, I would have found a way to
of
to
course,
get
of
some.
course.
You know what I mean? Because even then, between at 1995, I was getting the cannabis illegally here in Colorado.
It's well, I think there's always has been the black market, and a lot of families we speak with who are good friends of ours, they have children, and when they were talking about all the dispensaries popping up in California, they were really against it. And I said, listen, to get into a dispensary, you have to be at that time over 21 with a medical card. There's a bouncer at front. There's a someone checking you in before you make it into the back. So your children don't have access to it, but they'll always have access to it. They'll always know somebody at school who's selling cannabis. So that's where I was going with that. With bipolar, you mentioned THC, but you have also has talked about CBD. What for patients that I've worked with, I've had patients I've had success with high levels of THC, and others with high levels of CBD. And where are you in there? And I know you use both. Or are you still using both?
I am still using both. CBD is newer on the scene, but
Mm-hmm.
really for me, it was a matter of using the THC to a very minimal amount, like 1 or 2 puffs, you know what I mean? And I have to inhale because edibles, I wish I could take edibles, but they
Yeah.
don't get metabolized in my liver. So tinctures don't necessarily work. So inhaling it 1, 2 puffs only,
Mhm.
you know, 2, 3 times a day gives me enough THC to lift my mood and provide the energy boost that I need. And that is dosage control so I don't get too anxious. And the CBD that I take in tincture form now just rounds out the mellowness of any anxiety. The best is when you have flower that may be 1 to 1 or 2 to 1 or 3 to 1 CBD to THC,
Yeah.
and then the high is mellow as that goes. So I'm an inhaler. I used maybe a PAX vaporizer or when it was working, and that's how it works best for me.
So hopefully PAX is on here, which is a great brand. Maybe they'll send you a new one. Maybe we can get that to work out.
Or Volcano is the best, but I mean, vaporizing is the best. But
Yeah.
really, I use a glass pipe for 1 or 2 tiny puffs,
Yeah.
and it helps me a great deal.
Are you finding success? A lot of patients we work with have found success by certain terpenes. Are you going that far deep into that by finding cannabis or any cannabinoids that have certain
No,
terpenes?
I don't have access to it, and I don't necessarily believe. I don't think the dispensaries are going into that depth, except maybe one in Boulder who is more medically geared. I just go in really looking for the fact that I don't ask that question, is just the THC,
Yeah.
you know, to get me through.
Gotcha.
I'd like to be able to dial it in,
Yeah.
and that would be nice to be able to dial it in, but no.
Yeah, there's a doctor there that I'll introduce you. She's actually out of Colorado as well, Dr. Susan Trapp, and she specializes in terpenes. And I've worked with her on other shows, and I'll be inviting her on to this show.
I just met her. I just met her 2 weeks ago.
Isn't she wonderful? I mean, I just found out that there was over 55,000 terpenes out there, which I didn't have a clue how many terpenes were out there. So I learn each and every day. And not only in this show, but out in life, I learn every day. So with your bipolar, do you want to call it disease? Because a lot of bipolar patients don't want to call it. They don't want to call it disease. Yeah.
This is a disease. This is real.
Well, the reason I say that because a lot of the PTSD patients we work with, they don't want to call post-traumatic stress disorder. They don't want to call it disorder. And a lot of bipolar patients that I've worked with don't want to call it a disease. And so I kind of want to be politically correct on how you look at it.
This is a matter of neurotransmitters, and this is a real mental illness is real. And so it's right in there with any other disease that you would definition of a disease, in my opinion.
Okay.
As a scientist.
So with the science, you being a medical doctor, how is that working with the brain when cannabinoids enter the body?
Okay, so remember, and this is a remembrance for all of the people, it's not an either or world. I use cannabis in addition to psychiatric medicines that help me with my hypomania, help me with being calm, help me with sleep as well. That's the way it started out. So sometimes it would be a combination of using the two. In some case, for let's say anxiety or sleep, if you have a cannabis consult, and I recommend a cannabis consult with an expert regarding mental illness to be part of the team approach with regards to this, then you may be able to use CBD for anxiety or CBDA, or you may be able to use some CBD or a little bit of THC for sleep as well. So they should just be part of the team. So the question, go back to the question again, I'm sorry.
Yes. I'm trying to think the question about how it affects cannabinoids affect the brain and helping bring the balance of what you're going through.
It's all a matter of neurotransmitters.
Yeah.
It's just like dopamine, serotonin, all of the ones that control your mood in my case, okay? Just like in anxiety, just like in depression, simple depression. Remember, bipolar is a mood disorder, so it's both up and down, but it all involves the neurotransmitters in the brain that are being affected by the THC, CBD, and the minor cannabinoids as well as the terpenes as well.
Yeah, and I like how you said your case, because a lot of people, it's not a one size fits all. And as Dr. Bregman was saying, this is not to replace a one-on-one with your physician or medical practitioner. Everyone's different. What works for Dr. Bregman, someone else with the same disease, if you want to say, may use a different formulation. Or ratios. And so are you trying to find a cannabis product that has it combined, or are you taking THC in the morning, CBD in the day, or how?
I'm mixing the THC. I use THC flower.
Yeah.
And I do, now I ask for sativa or sativa hybrid. Between you and me in the industry, all of it is mixed up. Unless you know the genetics, they don't know what's sativa and they don't know what's indica. And it may be personal experience, no question about it. But I go in and asking for sativa or sativa hybrid. But if they gave me indica, it's the THC. Yeah. Would I look for ratios like 1-to-1 or 2-to-1 flower? But it's just hard to find. There's, at least here in Colorado, you still don't have a lot of dispensaries that are selling the ratios like they should.
Even in Colorado.
Even in Colorado.
That's you would think the opposite. You would think the opposite. One thing that I always say is that the recreational market, and correct me if I'm wrong, you live in Colorado, but we work with so many Coloradans, that the recreational market really has pushed out the medical patient. And so a lot of patients, and we're happening here in California as well, where the doctors are losing their businesses because people are saying, I don't need to go to a doctor anymore. I can just go down to the dispensary and buy, oh, you want to buy this? Yes, yes, yes. And they're like, what do I do with it? Well, that's why the doctors are there. They look at age, weight, current health condition, sensitivities, what other medications you're on. There are drug-to-drug interactions. And so with drug-to-drug interactions, and I know you mentioned a few earlier, are you still doing that, or have you been able to titrate down on any of those?
I'm still taking it. Nice. I haven't changed anything for the last 25 years in some of the medicines that I've had. Yeah. And I just haven't felt the need. I feel a certain balance has been reached. Good. For me, but certainly it's something to consider when you speak to a cannabis consult. You have an expert on the team. See, John, what you just said, unfortunately, if people we're still necessarily getting cards and going to the doctors. There are only maybe about 20 doctors in the country that really know how to dose cannabis medicine. Mental illness is tricky and do follow-up, but it's for anything: chronic pain, cancer, MS, any conditions that you know of. Very few doctors that know, and then very few doctors that will take the time to be able to call and have a team for follow-up to adjust the dosing.
I'm glad you said that, because I always talk about that. It's unfortunate that there's only a handful of doctors in the US that really know about dosing. Most of them will say, here you go, Paul, call me in a year if you want a renewal. And it's like, I need more than that. Or we receive the calls from families and patients saying, okay, I received my card, I have my medicine, but my doctor doesn't know what to do with it. And exactly. And so they're kind of like, what do we do now? We're still in the dark. We have it, but we're still in the dark now. Or they buy 50 different products to try them all.
John, that's the biggest black hole. That's probably the biggest black hole in our industry. Yeah. And the idea is, just for interesting sake, is a shout out to Dr. Uma in Massachusetts. She's on the verge. She loves to use the word titration as opposed to dosing, because she thinks that big pharma is going to eventually come in and use the term dosing as well, as opposed to us using titration. So that's an aside. But getting back to the point is just what we were talking about.
Yeah. Yeah. And I know Dr. Uma, she actually, Corinne and I did a conference in Maryland, and she was one of our speakers as well back in 2017. So she's doing a lot of stuff in the industry,
Lovely woman,
you know,
lovely woman.
and she's busy. She's busy. So maybe we'll get her on the show here one of these days.
Oh, I'm sure she will come
Yeah.
on.
Yeah.
Yeah.
So you want to share a little what goes on in your daily lifestyle? Do you ever, and not to get, and you can tell me no, but um, uh, you shared a lot about your kids. I don't know if you want to keep them out, or how's your relationship with them today?
No. Remember, as I moved forward in this process,
Yeah.
once I got the diagnosis at 41, the official
Yeah.
diagnosis, I was somewhat relieved. I was working.
Yeah.
I was the chief of mammography, breast imaging at Denver General Hospital between 1988 and 1995. So I had achieved, that's my legacy within
Yeah.
radiology. And so the idea was, here I was, and in 1991, in the midst of this, is when I finally met with a psychiatrist for the first time, and he gave me the diagnosis. So I was somewhat relieved, thinking it would be well managed and it wouldn't get worse, and I'd be able to maintain my career. I'd gone to school a long time to become a radiologist. And so then it got progressively worse. And then I had my first ECT. And so all of a sudden, when I was 41 and 45, my life changed from working full time to not working and having to resign disabled. And so all of a sudden, it was like, who am I type of situation.
It's amazing how, a friend's going through that right now. And I said, when you lose that, you lose your whole identity. You lose your whole identity. And losing a job and not even going through any mental illness. A friend of mine was just laid off. He's having a hard time, but he's a father, a husband, but he lost his identity at that time. I mean, still is right now. We're all going through this stuff right now. You mentioned a point about when you were diagnosed. Did that feel like?
Yeah, it certainly did.
No?
When I told you I was 41.
Yeah.
I was having mood changes that were, remember, I went through from 29 when I was in my residency, when it started, and there were too many things. Structure, the pace was quickened and there was a lack of structure, and that jarred me. But I made it through 29 to 41. And then I just happened to meet a young psychiatrist in the hospital. And I told him what I'd been feeling. And then he asked me about my father. He said, well, it sounds like you have bipolar or clinical depression. Why don't you come in to see me? So the idea was that it was a relief, because I thought we could treat it and I'd be on my way. Little did I know that I was entering this morass of just being in the swamp. And instead of getting better, I was ultimately going to get worse. So that was 91. 94 is when I had my first electroshock therapy, but I would have the ECT treatments and still go back to work, during that period of time as well. And then the idea was, in 1995, the depression hit so hard that I just couldn't see myself going back to work. And I was so depressed that even then I thought we'd get it under control and I'd go back to my career. There was such a feeling of relief of not going into work because I was so sick.
Yeah. Yeah.
And I had been so sick, 94, 95, 96, 97. That's when I got so sick. The idea was that I really thought that I was going to have to change my life and go into a hospital and really change it drastically. And that's when I decided to get married as an anchor to keeping me in this world while I was getting treated. So I've been sick since 95, and it caused me, my marriage wasn't necessarily a lovely woman, but not necessarily based on love. And then having the children, I was just afraid to go out into the world because I was so depressed.
with, and you guys are still friends, right? And last week,
Amicable, yeah,
yeah,
amicable relationship,
yeah,
but we're amicable also because we have a 16-year-old and a 19-year-old.
yeah, yeah.
She's 17 years younger. I'm 70. She's 53. I got married to her when I was 47 and she was 30.
She's my age.
Right.
She's my age. Wow. If you would have discovered cannabis back when you were taking a little time off back then while you're still at the hospital, do you think you could have stayed on?
No, I was too sick at that time.
Yeah.
And what killed me from leaving, why I had to leave the hospital situation, was the pace got to me, that I was reading and doing too many things, multitasking within that position. Yeah. And that's what the illness, bipolar people love structure.
Yeah.
But once the pace goes and multitasking is very difficult for them to do. And that's what did me in.
Yeah.
Maybe I could have done it less time and slowed down the pace. But I just think being in that environment was adding kerosene to the fire.
What a visual. What a visual. Do you still keep in contact with any of your colleagues, or has everyone just kind of?
No, the problem with mental illness and just in general is that mental illness particular, is mental illness when people know that you have a mental illness, most of them will ultimately disappear from your sphere because they don't know how to deal with you as a friend, and they don't know just a phone call. And I knew maybe over 100 docs in the hospital because I walked around and I said hello, and I was gregarious, like you know of me as well. So maybe 25 or 50. But once I left, I never got a call from anyone asking me how I was. And that still persists even mostly today.
Yeah. Yeah.
They don't see you as just having like a cardiac problem or a lung problem or something like that. They don't really know just to say, I'm thinking of you, sending you a text, let's go out for lunch. I'm going to drop off dinner at your house. What do you need? It's really, that became a shock.
Yeah. And it's unfortunate. It's kind of life. And I don't want to say take that away from what you went through, because they're friends that I haven't spoken to since Corinne passed. Everyone just gets busy and does their own thing. And it's tough, especially when you need, hey, that phone call, how are you doing? Thinking
That's
about
all you need. That's all you need.
Yeah.
Or a text. But they're uncomfortable with the topic.
I mean,
as
yeah,
well.
what do we talk? Yeah, exactly. So
just like they're unhappy, they have their lives, but also they don't understand just that little phone call would make a big difference. But with mental illness, it really frightens people.
Paul, I'm probably guilty of it myself. So if I didn't call you, here and there, I think we all, and so,
But getting back to your question,
yeah.
I didn't expect it from colleagues that I had worked 7, 8 years with, that I had formed real bonds with, and that these were doctors who knew why I left. You know what I mean? All of a sudden I was there, and the next thing I was gone. So it spread very quickly. And you'd think that a doctor would call up and say, man, I heard you're sick. I hope if you need anything, I'm not your psychiatrist, but I'm just here for you. Know that. And it was like mute.
Yeah. Does this happen to a lot of doctors? Because I've worked with a lot of patients, and a lot of our doctors that go through depression because of high stress, go, and then they go home and bring, the family wants them to be happy and play with the kids when they're still at work. And so, and this happens to some friends of mine that are doctors. And
well, I think that there's a component definitely of the situation that is there, but mine was definitely triggered with the fact of having the genetics.
Well, hereditary, exactly. And so is there a chance that either of your children can get this?
Yeah, 30% chance. If both of us had it, then there'd be 70 to 80%.
Yeah.
Okay. And then in my case, the fact that I have it, so it's 30%. And fortunately, that nothing's been shown up because 50% of mental illness can be shown up in kids before the age of 17.
Yeah. Yeah.
So yeah, I think about that, and hopefully everything so far has been good.
What can you share with some of our listeners that might be thinking, God, this is exactly what's been happening to me? Because you weren't diagnosed, like you said, until 41, but you've had it, you knew something was going on earlier in life.
At
29,
29,
you said,
at 29,
yeah,
before 29, I was a superstar. I never would have thought I had a mood disorder because there was so much structure and everything was in place, and I was able to keep my world like that.
yeah,
And then at 29, when the residency started, all hell broke loose. But I kept it looking together until 41.
yeah.
Even then, I just happened to run in this guy.
Kept it looking together. I mean, that's exactly what a lot of the patients do. You know, even talking about fibromyalgia, on the outside, you look perfectly fine. On the inside, they're in pain. As I mentioned, Beth gets up at 3 just to get out of bed at 6 in the morning because it takes that long for her body just to get back. And on the outside, she looks perfectly fine. So were people seeing the same thing with you? Like, no, this is Paul. Nothing
No,
wrong
they
with Paul.
saw, yeah, they saw different things. And maybe part of the personality was chalked up to being from New York and things like that. Now I was in the Midwest. But the idea was there was always maybe a little edge. And that just finally, the conversation that I had, it wasn't because I went to the psychiatrist at an appointment. It was when I was on call and we were having this talk at 1 o'clock in the morning, and he happened just to be there. And I explained to him what my situation was. And then he said, why don't you come into my office? And that's the way it started. It's not like if I didn't run into him, I don't know when and if I would have ever, I never spoke about it to my regular doctor,
Yeah.
never mentioned it. It never occurred to me that I had these, these mood, but I never thought about talking to a psychiatrist. And then when I did, it just opened up a whole world to figure out that this has got the potential to be that I need help.
So for any of our listeners, what can you recommend, some of your tips, because you've been through this? Sometimes it takes
Okay, so the tips are look at your family history
Mhm.
and see what, aunts, uncles, things like that, what mental illness, anxiety, depression, bipolar, schizophrenia, anything that runs in the family, okay, with really any health problem, but especially mental illness. If you begin to feel anxious, depressed, symptoms, you could look them up and Google them just to see how many of those symptoms you may or may not fit. And when you go to your doctor, discuss that with your regular doctor so they can do appropriate tests to rule out anything physical. Okay. And then if those symptoms of depression or anxiety or not sleeping or something that goes on, he may want to get a consult, or you may ask for a consult with the psychiatrist, just like you would have a psychiatrist, a therapist, or an expert look at any other part of your body. And he or she would make a diagnosis, perhaps. Now, at that point, it's a matter of how bad you're feeling, what you want to try. And so at least you have that covered. If you have the right access, like your group or calling me, because that's what I do now, is recommend cannabis information, cannabisresource.info, is you need a cannabis expert who has dealt with mental illness to at least be part of the team, to at least give you information, because the psychiatrist is going to give you traditional medicine that may help you right away, because a lot of people are well managed on that medicine, but at least you have the information about a cannabis consult. You shouldn't self-medicate yourself, if you're suffering with depression, anxiety, things like that. And then if you do have a diagnosable mental illness, you have options of treatment. What are the side effects? What are you going to do regarding exercise? What are you going to do about diet? How are you going to incorporate that into your job? How are you as a parent? Okay. And these things, and money. Who's controlling the money? The first thing is, who's controlling the money if you get diagnosed with an illness? Because you're going to go for therapy, and whatever you do in therapy is sometimes going to be difficult to take out of the session. And if you don't have somebody controlling your money and you get diagnosed early, in 20, 30 years, you could wind up being homeless if you don't have the right budget and the right control. And so I have a conservator who takes care of my money. I lost $200,000 along the way because I didn't know how to budget. Even if I didn't have bipolar, my father didn't teach me the value of dollar. He thought money was love. That was that generation.
Yeah.
But the unfortunate thing is, because of my bipolar, I needed someone to help. I needed all the money that I was collecting on disability. Okay. And remember, I was collecting 10,000. I had a disability insurance to cover radiology that I signed up for at 35. It kicked in at 45 when I wasn't going to go back to work. It was written for radiology. So I was getting a check for $10,000 a month. Okay. But I had no clue about the value of a dollar and credit cards and just how to manage and things like that. That money should have gone immediately to the conservator or somebody else, and I should have been put on a budget to say, you have $300 to spend each week, and the rest we're going to do. So money is key, the right therapy is key, the right diagnosis is key, making sure that your physical well-being is good, and then you have to figure out diet, exercise, and then how you're going to, and the major thing that you want to, after money, is you want to make sure, or before, is how to be a good parent if you have good children. Because the idea is you may make wrong decisions about who your life partner may be. And if you do have a life partner, how that marriage is going to change given her expectations and your limitations. The end of my marriage came across not only, it was a number of different reasons. We were very different people, but part of it was being her expectations and my limitations didn't match up because I looked so good. I mean, look at me now. You would never imagine that I have bipolar. And the
Or you're 70.
And I'm 70.
Yeah.
But the idea is I have bipolar. I've had it for all these years. I have it. I live with suicidal ideation. But fortunately, using the cannabis this morning has given me an upward swing to be able to be here and be able to be productive and move like this and not be out of control or any which way. Dosing is very important. I'm not taking a whole joint and smoking a whole joint. I'm just doing one or two tiny puffs to put me in a state where I am in good shape.
Yeah. And I'm glad you said that, because less in many cases is more. Less.
There's no question about it.
Yeah.
Less is more. And as you said, for me, I just need a touch of the THC. I don't do any dabbing.
Yeah.
I don't do edibles because I don't metabolize edibles like normal people. So that's why I'm there with inhaling in a glass pipe, or better, a vaporizer, a volcano, or a PAX, or something like that.
Yeah. With bipolar, what I've seen as well as studied is that a lot of patients that are going through bipolar have different vices, addictions. One could be spending a bunch of money, like you said. You had $10,000 check coming in here, and you're spending. You should have just spent 300, but you're spending the whole 10,000. So spending. Others have alcoholic addictions, sex addictions. Was anything like that with you, or was it just the money thing?
No, I didn't know addictions. No, I never had really any of those addictions, but went along. No. So the answer was no. It was just using the cannabis, and also money was a way. I didn't understand the value of a dollar, so I used it in maybe remotely or loosely in that way because I wasn't going to give up that control.
Yeah.
That was the only thing that I had the control of. So if you took that away, I would have just been out of not knowing that I had that when it should have been the right thing.
Yeah.
But no, but you're absolutely right. Other people do what I missed through my life, and what really has affected me now is the fact that I didn't have great models with my mother and father, and combine that with the bipolar is that I never really thought about settling down and having a normal life like you had with Corinne, or like other people get married in their 20s or their 30s or something like that and begin developing this normal life. For me, it was hard being a parent under normal circumstances. When you have bipolar and are depressed and irritable, it's almost impossible unless you have a nanny and you can separate yourself out. That's why the cannabis at least gave me some time to be able to smile and laugh.
Did they know that did they know dad was using cannabis, and did they prefer dad on, if they knew, did they prefer dad? Did they know when dad used cannabis and said, dad's back, or did you keep it
They're
separate?
19 and 16. So at that point, it was 2005. So they were 4 and 7. So they had no idea whatsoever.
Yeah.
Now it still hasn't come up in the discussion to say, do you use cannabis? Or they say, I'm using, they know that what I do.
Yeah.
Okay. And they probably Googled me, but it's not like we've had the discussion where your father uses medical cannabis to help. They know I have bipolar.
Yeah.
And they've known I have had a mental illness for many years because we've talked about it, but we haven't, when they're in their 20s, that's when I think we'll talk about that. And they haven't asked, but I think they know.
They may know. These are kids on internet now.
But they have access. I wouldn't be surprised if they Googled their father.
That's what I mean. I mean, kids nowadays, I have a goddaughter and she's 6 or 7 and she knows everything out there. She's like, and she knew this at 4, how to get on the internet or an iPad and type in stuff, and it just blows me away.
And they haven't asked.
Yeah.
And they haven't asked me about, do you use that direct question?
Yeah.
They just are uncomfortable. And
they're there in Colorado as well, right?
Yes. Yeah. Yes. My girl's in high school. It's junior, and my boy is a sophomore at University of Colorado, Boulder. I have good relationships with them now, but it took me that's the biggest regret that I have, is the fact that I wish they were 5 and 8. So I understand things better, so I could go back and hug them in bed and read to them and be more patient with them. It took me a long time to understand that. And this is relatively new. Last 2 years. So every day I text them and stuff like that. But it's taken me that longer time to be also understanding of the illness better.
Well, it's never too late to be a better father.
Loving. Better late than never. At least they'll remember when they can go over. I text them every day just to say, I love you, have a good day. So at least they'll have that when I'm gone. But that was part of the illness as well, because I was so angry. I was so angry that I was gotten this illness and I didn't know what to do. That's where Voc Rehab would have come in to help. The conservator would have helped.
Did you ever go to any rehabs?
Yeah, but I just was so upset, and the jobs were so menial, and also it just messed with my mind. I couldn't get my head around it, but I think there would have been something for me. Definitely. I did do, John, I did work from 1995 to 2005. I was very active being a mental health advocate. So I made inroads in that community, and I helped get insurance for mental illness in the state of Colorado. I was one of the doctors did that. So I helped with that. In 2007, I started doing mental cannabis evaluations. And I was one of 2 doctors that testified in the Colorado legislature with Alan Shackelford for common sense.
Where is he nowadays? You don't hear about him anymore.
He's around. He's doing stuff in Israel. He's doing
Yeah.
stuff here.
You heard about him everywhere back in 2011,
There's a very nice article written about him in Project CBD by Mary Biles.
Okay.
Anyway, so I was involved. This was 2007.
Yeah.
And I was using cannabis, and I was doing I did 3,000 evaluations in the early days when people were getting cards, and paying whatever. And I was doing that and very functional. But then what happened was the Colorado Medical Board, I had to go to the Colorado Medical Board to keep my license active after I stopped practicing radiology. So I would see them 3 or 4 times a year. Just go in, how are you doing? Everything's fine. Might be seeing my psychiatrist. One time I felt good, and they said, how are you doing? 2010. I said, I'm doing great. They said, what's happened? You were not doing that great for many years. I said, I'm using medical cannabis. That became a 3-year battle where I was the precedent setting case that you cannot have an active medical cannabis card and also have an active medical license in the United States. So my license in 2013 had to go inactive. And I was functioning, no malpractice, everything going fine. I wouldn't smoke before I went to work. I wasn't going to work high. I was just doing my thing. I try to convince them that I could be an educator as well, but they're conservative. They're conservative, and so my license was even among all of this, I lost my license to practice in 2013.
Again, taking away the identity.
That was brutal.
I remember those calls. And they were tearful calls.
So that was brutal. And so since that time, I've reinvented myself with cannabisresource.info. So people call me for information, like they call United Patients Group, but they also call me on an individual basis. And I help them find the right doctor for their expertise for chronically ill patients.
And you and I have worked together on cases like that as well. And so, I want you to have spotlight and give yourself a plug because, you've walked a day in their shoes. You know what's going on. You've been on the medical side as a medical professional, as well as a patient. And so many of our listeners, as I mentioned earlier, who may be thinking they're alone, they're not alone. And so can you share how people can get a hold of you and some of the guidance?
Yeah, thank you. So it's cannabisresource.info is my website, cannabisresource.info. My name is Paul Bregman, Bregman. You can Google that, Paul Bregman, Bregman. But cannabisresource.info is the best way to get in touch with me, or call John. Especially if you want to speak about mental illness or just to get my insight, because it's not only, you have to remember with me, it's not only about the cannabis, okay? The cannabis helped me, but cannabis is in common. I can't emphasize enough the whole team approach about how to do this. I have a way that I think can help manage and make mental illness be better managed, not just through cannabis, but in combination with Western medicine, perhaps, and the team approach about money and job and support and suicide prevention as well. You have to remember, suicide is almost 100 people a day commit suicide. Forget about 75 attempts by veterans and 20 accomplishments. So suicide is the ultimate thing that we're trying to prevent here, as well as the suffering that people go through. And if people get the right cannabis consult with the right expert, you can bring it in and round things out and incorporate the best of both worlds like I do. Remember Depakote. A lot of people take Depakote and don't want to take Depakote because they gain 30, 40, 50 pounds, become diabetic. That didn't happen to me and was a good mood stabilizer. But the cannabis consultant working with the psychiatrist can perhaps round things out. Remember, your psychiatrist is not going to know anything about cannabis. And the cannabis doc will probably have faced people who have come to them with taking all of the psychiatric medicines. So that's why they should be a member of the team. But for my own, what I was left with after they took away my active license, now I'm inactive, was at least being able to give out information and be able to give lecture and talk about CBD. And while I'm not prescribing or treating anybody, I'm a wealth of this information and I've lived it, especially mental illness, because again, people don't want to talk about mental illness like I'm talking about.
Well, that's exactly why I wanted you on the show to share your knowledge, your experience, your expertise. You know, I don't want to say I've become an expert in pancreatic cancer, but you know what? I've learned a lot, and so I've reached out. I mean, a lot of people come to me and said, "What have you learned?" I mean, when you're in it, you know, it's unfortunate. Sometimes it takes experience to become an expert, good and bad. And so, thank you for sharing. I want to talk about, before we go, you were talking about, I call them like about the pillars of life, and I'm so happy you brought that up about exercise, diet, love, being a good person. Are you incorporating those are you able to incorporate those in your life
It's
right now?
been very difficult
Yeah.
because I'm just happy to be able to get up
Yeah.
at a regular time, walk the dog, do the basic things like that. I have a meal plan that works for me,
Yeah.
that sometimes I cook, sometimes I don't. The exercise portion has been, I'm trying to get back into it. It's been difficult when you suffer from depression and you doing this by yourself. Remember, I don't have a partner, so I'm alone with this. The motivational aspect of things. I'm successful if I can get to the shower and take a shower and get dressed for things as well. But you cannot discount that if you're in a regular exercise program, not even that much,
Yeah.
but regular, and you're eating a good diet and you're getting enough sleep and you are making sure that you have regular doctor visits and dental visits and taking care of those type of things, you will lead. Those are the foundations for leading a better and more successful life, in addition to the other things that we talked about for bipolar. If it's not there, if you're not eating a good diet, you're not getting some good exercise, and you're not getting enough sleep, you are not going to be as successful in managing your mental illness.
That's
And
why
that's easy. That's a key.
and that's why it's so important to have that on the team. You know, someone's going on there too, working together. Can you share again how people can get a hold of you?
Yes, again, my name is Paul Bregman, Bregman, MD, Denver, Colorado. My website is cannabisresource.info, cannabisresource, all one word, .info, 303-550-4115, 303-550-4115, Denver, Colorado. And you can get in touch with me that way, through John as well. John will be posting this, and it'll be under Paul Bregman Mental Illness. And I think I can make a difference. I know I can make a difference in the management of mental illness. And I know how cannabis and CBD affected me. I don't think that if I would have had the CBD and the cannabis, that I necessarily would have had to go through the electroshock therapy, which people should not be afraid of.
Can you talk about the electroshock? I meant to ask you that question earlier, and then
electroshock therapy is a very widely used benign procedure that people are going into the hospital all the time. It's a outpatient. It's an outpatient procedure whereby they anesthetize you as in a room. They come in, they put you out for about 20 minutes. They hook up electrodes on one side of your brain, over your head over here, or both sides. They put a current through your brain while you're out. That's like the 60-watt electric bulb. It causes a convulsion. The convulsion changes the neurochemistry, dopamine, serotonin, things that the cannabis does, but this does it in a different way. And you usually have 10 to 15 treatments over a period of 3 weeks. And your depression or mania, it's got 80 to 90% success rate in treating these depression that doesn't respond to medicines or that get worse, or basically it's not the first thing that they're going to do. It's going to be at the end of the road for that. And that's why I had it done for me. But it's benign. It has side effects in the fact where you can have memory loss that may or may not come back. That's the biggest downside. But I looked at it. I had over 100 treatments with electroshock therapy. I had it every year when the days got short, November, December, January, February. I had 15 treatments over between 1994 for 8 years. So 8 times 15. So the idea was, and I had them in 15 treatment intervals, 3 times a week for 2 weeks, twice a week, and it would lift my mood and last for about 6 months or so. So people have this horrible one flew over the cuckoo's nest type of image of ECT, and it's totally different than that, except for the possible memory loss. But I was much happier. I didn't have memory loss. In fact, I think my memory got better, okay? But which is rare. I had no memory loss, but at least I got my mood back. And that was, all of a sudden, I went from an 8 or a 9 or a 10 and a lot of suicidal thoughts to at least my depression was lifted and I was a 1, 2, or 3 for 6 months.
Yeah, a few months. What about light therapy? I know a lot of bipolar.
Light therapy is a given for especially those with seasonal affective disorder. I use light therapy starting now, short interval, 10, 15 minutes in the morning, maybe 5 minutes. So light therapy is key. I think ECT at the end road, they have other things. If you're suicidal, okay, and or depressed and can afford it, but ketamine, Ketamine, Ketamine. They have ketamine clinics around the country. And I've had ketamine injections. They infuse you.
They do injection. They do
in a dark.
and they also, I think they do eye drop ketamine.
Nasal spray as well, but they can't control the dosing as well as having an IV. Sure. I had an IV and I was there for an hour. And if you're suicidal thoughts, it's like they are erased.
Wow.
Erased. And if you have depression, it can be lifted 50%, 67%. It's just that it shows it's very short acting. The feelings may only last 24 to 48 hours.
Oh.
And that's the key thing. Each injection may be $300. Insurance may pay $150.
Yeah.
It's a great drug. They just haven't found out yet how to extend it.
How did it become, and I appreciate your time. I know we're going over.
Oh, that's okay.
How did it become, because ketamine was used for a tranquilizer for horses at first, and I think they still do. And then how did they find out, hey, this could help patients with depression, suicide thoughts, etc.?
I think the first step into the human world was that they used it for pain in the ER for pain in human conditions. They found that it relieved, relaxed, as well as used for pain control. Okay. How the next relief may have been just by chance of talking to somebody who was in pain, but also maybe psychotic or suffering from a mental illness. And the patient said to them, man, that was great. I don't feel as bad as I felt. And then they made the leap to where they are now. Is there a clinics?
So before that, was it a horse tranquilizer and then it made to humans, or did it go human, horses, back to human?
No, I think it started horses into the ER, I think, for pain. And then this last jump has been for mental illness. And I don't know exactly how the thought process was, but I wouldn't be surprised if a few patients remarked how much better they felt mentally. And the next big leap is going to be the leap where doctors are going to be trained in the use of psilocybin.
Which is a topic we just had Brad
Yeah, you
Burge on
just
the
had
show.
the other day, right? So
And
psilocybin is,
yeah.
I mean, psilocybin should be widely used in hospice settings, okay? Because the people who are dying, you have so many people who are afraid of dying.
Yeah.
If you give them psilocybin and let them see the other side, perhaps, or however that trip is in a controlled dose, they come back to their bodies and they say, I'm not afraid. I saw the other side and I'm okay with it. Okay. And that's what's happening there. With myself, I was suicidal thinking and depressed. And when I had the disassociation, it's like you're sitting in the chair and with the ketamine, you slowly float up to the ceiling and you're looking at yourself in the chair as well. And then as the hour ends, you come back together into the chair and your brain is just completely flushed of the negativity that you went in there with.
It's amazing. You're talking about a team, but it's also an arsenal. And I'm the first to always say cannabis is not the one size fits all fix it. And I think sometimes it takes an arsenal of different tools or weapons, however you want to see, to bring your body back. And nowadays, I think ketamine is even approved by the FDA. Is that correct? And
oh yeah, oh
and
yeah.
So it and maybe after this election, I think in Colorado for medical use, or they're not. What's the story with psilocybin in Colorado? And I think the same thing.
Well, they just passed. They're doing trials.
Trial.
There are trials in places, and they just passed that it's legal to possess it and things like that. And that happened in Oregon, that I just think recently as well. So that's becoming. But in the meantime, they're putting tons of money into research.
Good. Hopefully they put some research in cannabis research as well as all these other.
Well, the ironic thing is they're putting more money into the research with the psilocybin and the psychedelics than they are still into cannabis. Is there, but it's still not as much as it needs to be.
Wow.
Because look at the opioid situation. I mean, you have opioid town halls and nobody brings up cannabis by any of the experts.
Well,
and the same thing with mental illness. The same thing with mental illness, like myself. If I didn't have cannabis, the doctors, that's what my psychiatrist told the board. The guy, we don't have anything more to give this guy. That's what patients call me. They call you. The doctors told me they have no more to give me for my fibromyalgia or my depression or anything. What am I supposed to do? What happens if I didn't have the cannabis to help me like this? I probably would be dead. John, I probably would have been either in a hospital or probably had enough and just killed myself. This at least gives me periods of time when I have some hope and I feel better and can be productive like I am also with you. If I wasn't using cannabis, some days I've had to cancel a couple of podcasts because I was so depressed. You can't imagine how paralyzing that is.
Yeah. But even as you said, there's days sometimes it takes that much to get up to go take a shower, to get dressed.
Just to go shopping or just to do it. And I have to force myself and do it and whatever. It's very, very, you can't imagine how difficult, this is.
You spoke about hope. I talk about hope all the time, and I never want to give anybody false hope, but I think hope is very important. You sharing it gave you hope to get to the next day. And I know your conversation with me today will give one person hope. And that's why I look at it. If it helps one person, then I know it was a successful, I know that's a successful conversation, but a successful conversation for someone else. If we can help one person, then I know that what we've done here is the reason why we did it, to give.
And also it's cathartic for me.
Yeah.
You have to understand too, it's this is good therapy for me, and it helps me with knowing what you just said. But it also is the idea is because I speak the truth.
Yeah.
You know what I mean? I know this is, and about the team approach and the way cannabis can be, but it's got to be in the person with the right hands.
Yeah.
If they start to self-experiment and they start to do dabbing and they start to do these high doses of THC and other stuff like that, they really could get themselves and throw them into a psychotic episode, or they could really do more harm than good.
Yeah. Well, Paul, I love you, man, and really good to
Love
see you.
you.
Really
All
good
the
to see you.
best. Thank you very much.
Thank
Short
you.
notice, but it was great.
And that was great. We've been talking about this, and then I for our listeners, I called Paul. I said, "Hey, I had a cancellation day. Are you available?" He's like, "When?" I said, "A couple hours. Let's do it." So,
I'm there.
I mean, it's good to see you smile, and
Thank you. You made me smile, John. You
I
made me
love you, man,
smile.
and really good to see you. And can't wait to see you face to face again.
Exactly. But in the
A
meantime, we'll
lot-
stay in touch.
Definitely.
If you need anything, I'm here for you, as always, like you're there for me. So
Yeah.
all the best. Okay.
All the best to you, and to our listeners. I thank you. This has been I've really enjoyed this conversation. But if you're going through something like this, give Paul a call. You know, he's experienced it. He's seen both sides, and
Cannabisresource.info.
Yeah.
And John, 303-550-4115. Bregman, Paul Bregman, MD, Denver, Colorado.
or Google him, because his kids aren't Googling him yet. But
Oh, yeah, I have a controversial background. You'll read about me, and I'm not, no malpractice, no bad things. I just, I tried to do the great thing, but was just a pioneer.
Well, you're a pioneer, and you are actually one of the pioneers. And so thank you. And I'm honored to know you and work with you as well. And we'll see you soon, everybody. John Malanka with United Patients Group. Be informed and be well. And I hope you enjoyed this conversation as much as I did. So blessings to you all. We'll see you soon. Bye-bye. Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA, that's right, USDA certified organic hemp and CBD brands. And all of its hemp is grown from the perfect topography and climate found in Colorado. It is a family-owned business and is deeply committed to the science of providing only the purest hemp and CBD products for the best results and most beneficial experience. Its mission is to bring the therapeutic value of pure, organic hemp and CBD to people who seek supplemental relief through the use of healthy, natural products. Aspen Green is free from toxins and runs up to 8 different lab tests from bona fide third-party labs throughout its product line. It holds in high regard 3 foundational principles that guide every aspect of their business, actions, and interactions with their customers, partners, as well as their community. These are quality, integrity, and transparency. These will always remain at the hearts of their efforts to bring their beneficial products to consumers. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Again, UPGCBD for 20% off at aspengreen.com.